This is the 1010 Sinclair Housing training for checking tenants for bodily changes. When performing your duties, you're going to advise the tenant of any bodily changes you notice. These include skin discolorations, sores or open wounds, urinary odor, or infections, as well as any other changes to their body. This needs to be performed every day and at every opportunity. A good time to check for these would be during dressing and bathing. If the tenant is on bed rest, quick skin checks are really important to do at every turn. You're going to want to be aware of pressure sores. Prevention is the key to help avoid pressure sores. By letting the tenant know that there is a red or discolored area and moving off that area can relieve the pressure so it does not develop into a wound. Once a tenant has a pressure sore, it is important to continually tell them how it is looking. Some do not get past stage 2. However, this is usually a small wound and needs to be watched closely in hopes to avoid this progressing. These wounds can progress very quickly and may take a very long time to heal. Stage 3 and stage 4 usually need wound care via nursing. We'll now look more in depth into what a pressure sore is. Now to get started, wash your hands thoroughly.
Pressure sores, also called bed sores or decubitus ulcers, are regions of skin that break down when you sit or lie in one position for too long. These wounds occur most frequently in areas where your bones are close to the skin, including your heels, ankles, hips, tailbone, or elbows. Pressure sores are categorized by degrees of severity. A stage 1 pressure sore is reddened, inflamed, and does not blanch or become pale when pressure is applied.
With non-Caucasian skin, what we need to look for is subtle changes in their natural skin tone. We will see what's called a dyschromia, or a darkening of their skin tone. So don't be fooled looking for erythema in darker complected patients.
A stage 2 pressure sore appears as a blister or an open sore. The area surrounding the sore may be red and irritated. A stage 3 pressure sore involves a full-thickness loss of skin that appears crater-like and extends to the layer of fat beneath your skin. Stage 4 is the most severe. A stage 4 ulcer is a full-thickness wound that extends down to the underlying muscle or bone. In 2007, the National Pressure Ulcer Advisory Panel added 2 more ulcer stages: suspected deep tissue injury, and unstageable. Suspected deep tissue injury is a maroon or purple area of the skin and may contain a blister filled with blood. It looks like this because of damaged soft tissue underneath your skin. An unstageable ulcer is a full-thickness loss of tissue. However, the amount of tissue loss cannot be determined because the ulcer is covered by dead tissue.